Dr. Larmour here, talking about the chiropractor and the chiropractic adjustment. Just like there's differences in tomato sauces or sauces in general in the genre of Italian food, there's differences among chiropractors and techniques. We have instrument adjusting, we have diversified adjusting, we have table-specific techniques. Do you know what kind of technique your chiropractor performs, and is the chiropractor addressing your condition and the technique? Again, I like patient preference. If you're going to ask me my sauce, it better be red, thick, and nothing in it. Don't mess with it. Other people like different styles. My children like Alfredo sauce. Oh my Lord. Otherwise, talk to the chiropractor. See if he has different techniques. We'll introduce you to some of the techniques in this video and the instruments that the chiropractor would use. It's just not popping and cracking. Here we're in a room with our drop table. The drop table is designed to assist me with the adjustments. I will evaluate the patient, typically on the stomach. We're going to adjust the low back. I raise the table gently, and along with the adjustment, we're going to put a light force into the patient. The table's going to drop, and it's going to assist with the adjustment. Again, easy technique for reducing the subluxation. Here we're still in the room with the drop table, but we're going to change techniques. This technique includes a board and blocks. It's called Sacro Occipital, or SOT. It uses more leverage and time. The patient, again, is on their stomach. We'll use a board for stabilization, and we put blocks in a specific pattern to reduce the inflammatory response and the subluxation at a specific level. Gentle, low force, high specificity. Here we are in a room with a Flexion Distraction table. It's a motorized table. We use this with patients with an inflammatory process, maybe in the disc or a sciatica. Here the patient is laying on their stomach. We use the table mechanically to distract the lumbar spine. It allows me to work on the muscles and the vertebral segments of the lumbar spine, thoracic spine, to reduce the subluxation. Again, this is Flexion Distraction. Here we are in a room with a Leander table. Great table combines drop technique with a motorized Flexion Distraction. Here I can use drop technique with the cervical spine. Again, you hear that pop with the adjustment to assist in adjusting the cervical spine. But at the other end of the table, I can use the table to work on the lumbar spine. Here it's motorized, so it allows my hands to be free so I can work on the spine, pelvis, and lower extremities. We're getting the same decompression of Flexion Distraction, but I don't have to do the work, the table's doing it for us. Again, combining drop technique with Flexion Distraction, another technique. Now we're going to talk about our last technique, or impulse adjusting. It's fairly new. It's electrically powered impulse or instrument adjusting. It's going to make a noise. It's like a tuning fork for the spine. Different techniques can be used on the same individual. You can do drop to the neck, and you can do impulse to the low back. Again, becoming educated on the types of therapies and the types of adjustment the chiropractor does is the educated consumer. That's what we look for here at Larmour Chiropractic. Again, we've talked about different types of techniques, and we've been educated on the types of chiropractic the chiropractor can perform. However, there's still patient preference. You can go for a little or you can go for a lot, depending on what you like, discussing it with the chiropractor. Again, patient preference is important, as well as being educated on the types of care that are offered, especially here at Larmour Chiropractic.